Consuelo Wilkins. I'm a physician and researcher and the Vice President for Health Equity at Vanderbilt University Medical Center. If I look at my actual REDCap dashboard, I have many dozens of projects that span all of the work that I do at Vanderbilt, from the research studies in our Recruitment and Innovation Center and our CTSA program, but also for my own team as we focus on health equity and health disparities. We use REDCap a lot to collect, all the really important data around social determinants of health and identity. In the broader community, we're using it in roles right now during the pandemic to collect data while we're testing community sites. So walk-in, drive-up sites, we're collecting the most important data to help us track COVID-19 using REDCap. And so the practicality of it, the ease of use, all of those things I think are just so invaluable.
Hello, I am David Haas. I am a professor of medicine in the Division of Infectious Diseases at Vanderbilt. I've been at Vanderbilt now for 41 years, and I am also Associate Director of our Tennessee Center for AIDS Research. And I also run our HIV clinical trials programs focused on therapeutics. We were working with the University of Witwatersrand, one of the largest universities in the world. And we went there to talk to them about REDCap. And it was about the clinical research they were doing. We talk about data management, and I talked to the person there who was the director of vascular surgery, and he said at the time, we do more work than anybody else in Africa. We do more surgeries. We see thousands upon thousands of patients with the most unusual problems in the world, but we never collect the right kind of data in the right way, so we can never actually understand what's going on. So I said, well, the easiest thing is just create a simple REDCap database and just collect information on every person you see. So I saw him a year later, and he said, that one piece of advice was the most transformative thing we have ever seen, because just by that very simple thing, which was free, now we just have this beautiful data on all our patients, and we can now understand our outcomes. We can understand when we do something new, what impact it will have on what we're doing. And that's a scientific research question, but the exact same applies to anything you're doing. If you need to be tracking data, track quality, track outcomes, get people to reliably, consistently provide you information.
I'm Jill Pulley, and I'm the Executive Director of the Vanderbilt Institute for Clinical and Translational Research. I help organize the translational science infrastructure and environment in a way that is supportive to researchers and to research. And one of my roles is to lead a drug repurposing program where we work on finding new uses for generic drugs. And so the clinical trials of these drugs need to be done very inexpensively. So we are totally enabled by REDCap in that regard. We have 5 phase 2 clinical trials that are ongoing right now, repurposing generic drugs. And we use REDCap to capture data, all data collection, all management, all organization. The fact that there are no hidden costs to REDCap means that we don't need to worry about the technical costs of data collection at all. And so we can conduct lean and efficient clinical trials. And there would simply be no other way to do this activity without REDCap.
Hi, my name is Russell Rothman. I direct the Institute for Medicine and Public Health at Vanderbilt University Medical Center. From a research perspective, we use REDCap and MyCap and the tools associated with it for much of our research activities. So really, I would say that REDCap has just become a daily part of what we do in the Institute for Medicine and Public Health, and has made our work so much better now that we have REDCap as a tool.
Hello, I'm Gordon Bernard. I'm Executive Vice President for Research at Vanderbilt University Medical Center. I oversee the areas of research that deal with clinical and translational science. And I'm a pulmonary and critical care trained physician, and my research is in critical care. We've had the opportunity to use REDCap extensively in dealing with studies coming out of the COVID-19 epidemic. One of the things that's been particularly gratifying about the availability of REDCap is the public health use of REDCap. Departments of health in cities and states across the country have brought up REDCap databases and used REDCap survey to actually keep track of exposed patients and close contacts in ways that allow them to organize their efforts to contain the epidemic in their cities or states. And this is something that has been repeated dozens of times across the country and actually across the world.
I'm Jennifer Pietenpaul. I am the Executive Vice President for Research at Vanderbilt University Med Center and also the Director of the Vanderbilt Ingram Cancer Center. Vanderbilt Ingram is a very large NCI designated comprehensive cancer center. We have lay navigators who we need to manage the workflow. And REDCap's really enabled us to take any workflow we've had in this area, whether operations or administration, that used to be managed with spreadsheets and improve our data management, our reporting, our integrity, our tracking, and our logging, all using REDCap. And so, as I said, it's an amazing tool, and we've actually used it more for workflow management and operations than even as a survey tool.
Hello, I'm Edwin Trevathan. I'm professor of pediatrics and neurology and a pediatric neurologist and epidemiologist at Vanderbilt University Medical Center, where I direct the Vanderbilt Institute for Global Health. REDCap has been instrumental in our expansion of our global health activities, and I think especially in low middle income countries. This has helped us actually collect more data faster to eliminate a lot of paper in our research and our data collection, and improve our ability to respond quickly with data and use data to solve problems, and also to be able to answer questions in our research more quickly.
Catherine Hartman. I'm the Vice President for Research Integration at Vanderbilt, where I also am affiliated with our CTSA. In that role, I lead the training programs for pre- and postdoctoral scholars and also for our early career faculty. And for that reason, I'm also our Associate Dean for Clinical and Translational Scientist Development. We have a program that we share with more than 22 other institutions called Flight Tracker. And Flight Tracker is a database system designed specifically to track individuals who are pre-doc, postdoc, or early career faculty into the rest of their career life. So not just while they're under your roof. Our staff who have to prepare training grants and annual progress reports spend an enormous amount of hours transferring information from program spreadsheets typically, which is what REDCap was designed to present as a data tool to keep us from using ineffective ways of organizing our information. Having a good REDCap database is paying off in many, many ways.
Hi, my name is Julie Ozier, and I'm the Director of the Human Research Protection Program at Vanderbilt University Medical Center. Our office oversees the research done on humans, so any clinical trials or human research that occurs, we review and approve to make sure it meets the regulations governing. And we just don't have to think about it. If an investigator comes to us and says, we're using REDCap to store our data, we say, great, we know exactly what that is. We know it's very secure, fantastic. And the same with the e-consent as well. If they say this is the process we're going to use and we're going to do it through REDCap, we already know it's secure. We already know it's going to operate the way we expect, and it's very useful and flexible.
Hi, I'm Kevin Johnson. I'm Cornelius Vanderbilt Professor and Chair of Biomedical Informatics here at Vanderbilt. I'm also Professor of Pediatrics, and I'm Informatician in Chief, which is the head of the informatics initiatives on our campus. REDCap makes a difference in ways that I have always imagined and a few that I've never imagined. I fell in love with REDCap as a survey tool to replace SurveyMonkey in my own research, where every time we think, let's do a survey, we now go to REDCap. So the number one area that I would say REDCap has transformed is my personal ability to do surveys reliably and with a great toolkit. The one that's a little bit less imaginable is that REDCap is now starting to find its way into electronic health records through some of the work that Paul and I have done with our EPIC collaboratory here at Vanderbilt. And we're now learning ways in which people can introduce REDCap survey completion into care practices, which is extremely exciting.
One thing that's been fantastic about REDCap is that we've actually gotten our community partners to use REDCap, to the point that some of them have specifically asked to use REDCap for themselves. They want it for their own projects. And I've been delighted that we've been able to offer that to them and provide it for them. They've become their own, experts in using REDCap.
I think what makes me so excited about REDCap in clinical and translational research is that it's the single answer. You don't need any other modules. You don't need any other systems or tools or technical solutions. It can provide whatever you need by itself with no extra costs.
So, and I think the culture that Paul and all your team have developed around REDCap has been helpful. There's a very collegial, collaborative culture, and that really is the culture that basically where the REDCap administrator and the investigator are partners. Because this type of computer technology and software can be very intimidating to people that aren't experts in it. And I think the system and the culture of REDCap that treats everyone as a partner, and that, REDCap is there, REDCap is your friend and not something to be afraid of. I know that hasn't happened by accident, that it's been intentional. And that is really important. I think especially when we as Americans go into other countries, having that, being able to bring a culture of collaborative friendship really makes a big difference.